The nervous system controls all healing and all function. It controls the hormones, it controls sleep, it controls digestion, it controls immunity, it controls the person's level of energy, their emotional regulation, so how they react to their environment, how they react to the world. And here's what's really important. It controls the cellular reproduction and replacement of all organs. So one of the things that we really have to help the patient understand is that their body is constantly replacing themselves. And it's either replacing themselves, those organs are replacing themselves with healthy cells or with unhealthy cells. And if they choose to remain subluxated through their lifetime, their organs and their body are replacing themselves with unhealthy cells, and they live a lackluster life that's typically shortened. It's really important to help them understand that. You know, the whole purpose of today's call, I wanted to, Brian and I were talking yesterday, and one of the things we have the intention of doing is we feel like it's information overload for you guys. And I know I'm the type of person that I want to provide as much value to you as possible. And it's up to you to take it and use it to your discretion and use it for your purposes to improve. I hope that you're doing that. But I'm going to say I feel the majority of the group is only scratching the surface. So we want to try to make these calls very impactful. So today, what I wanted to do is I wanted to really give you some tools on ways to reposition your office. And what I mean by that is to reposition your office to become the corrector of subluxation, the office that transforms lives in your community. So you set yourself up as different. So people start to recognize you and get referred to you because you're not the treater of pain. You're not just the person who quote unquote cracks backs. You are the person who really leads people to a better life. And so I've got some things today to really, it's for you. But if you can take some of the premises we're talking about and use it in your communication with your patients, I guarantee your practice is going to improve. Your patient commitment will improve and the patient retention will drastically improve. So we're going to get into this. So again, I've got some information. I'm going to share my screen with you guys. Please, I'm begging you guys. I would love for this to be interactive because I feel like a lot of you guys you come, you turn your camera off, you do whatever you do in your house or you're out for a walk or whatever, and you just kind of just listen to what you listen to and you're really not engaged in the call. So I would love some interaction. So if you have questions, comments as we go through this, please just interrupt me. I would love the input. The group would love your input. If you have something to add of value, please do. And if you have a question, no question is too dumb. So don't be afraid to ask a question. Okay. So here we go. Brian, do you have anything to add before we get started?
No, I guess the biggest thing, I don't know how many people jumped on that pure principle call, but a lot of this comes about the mindset. So I know whenever I'm in growth mode, whenever I'm looking to make an improvement, I go into every call or every seminar or book I'm reading or podcast I'm on, whatever it is, and I'm looking to take one thing from that. So I would encourage you when you come to these calls, we all have areas in our practice that we're looking to improve, right? And so you're coming to this call like I'm looking for that one nugget that moves me in that right direction. If not, and I've been guilty of this in the past, like I can't tell you from my, first probably several years in coaching. Now I've been coaching since, 2002, I think I started coaching with Mike Reed back then. But then like I came home with notebooks and notebooks full of great notes and content that would have me excited for a couple of weeks, and I kept on doing the same thing until I started to come back with action steps. It never really made impact in practice. And so that's the thing. You can either be like a content consumer or someone who's taken action on that. So I'd really encourage you guys, look for at least one thing here, ask some questions. I know from those of you who I coach, these pieces, there's some big pieces here that you want to get better at, as we've been coaching on. So this is where you ask questions, you engage, is how we move forward.
Thank you. All right. So today, we're going to talk about taking your practice from the symptom pain-based practice into a subluxation correction practice. But it's really going to expand on just the idea of subluxation because a lot of us in the profession don't really truly understand what subluxation is. And I'm going to give you three dimensions of subluxation today. And I know this is going to be eye-opening for many of you. And I know if you can get really good at communicating this, Patients' lives transform because their mindset transforms, their health paradigm transforms when they understand this. When you can get them on these to understand these three dimensions of subluxation. So we're going to talk about this as we go through this. So there's really three levels of subluxation. The first and the lowest level is the structural. So for those of you or for those of us who are subluxation based chiropractors, many of us get stuck in this structural correction of subluxation. And we're going to talk about how to identify that. The next level of subluxation correction is the neurological component. And that's really the outcome measure that we want. And so we're going to talk about how to take people from understanding the structural component of correcting subluxation, which is, again, way beyond the whole pain relief model, but into the neurological component. And then there's the ultimate component, which helps people understand that this is a lifestyle thing. It's totally outside the realm of symptoms, and that is the spiritual component of subluxation. I want to really clarify how to communicate that so it doesn't come across weird for you guys, okay? And I know this will make a huge difference for you. So here's the biggest question. So what if the biggest problem or the biggest health problem you have isn't the pain you feel? For patients, it's not the pain you feel, but it's the dysfunction that you don't feel. This is what we have to understand, is that people come in with a symptom. That's not the problem. That symptom is being caused by an underlying problem, but that underlying problem is causing a dysfunction that is far greater than the symptom. Pain's often the last symptom to appear, the first symptom to disappear. We all know that. If your health decisions are based on pain alone, you're making decisions far too late. And our job as chiropractors, as subluxation based, vitalistic, neurologically focused, innate driven chiropractors, our job is not to chase symptoms. Our job is to locate, analyze, and correct interference to your body's ability to heal and adapt. That's the big thing. Adapt to our environment and function at our highest level. So the lowest level is the structural subluxation. This is the foundation, right? The foundation analogy. So if you're building a house and your foundation of your house is off, it's not level, or it shifts even by a few millimeters, everything above it compensates. It's the same in the spine. So that's when we're, as structural corrective type of chiropractors, a lot of us get stuck in this stage. So structural subluxation, we talk about misalignment, we talk about abnormal movement, range of motion patterns, we talk about the loss of curve, rotational distortion, pelvic unleveling, the bilateral weight scale is off, all these different things, uneven load distribution. And what that causes is accelerated degeneration. Well, that's important. And that takes the patient out of this pain-based model, the symptom-based model, to a root cause corrective model, but it's still the lowest level of communicating subluxation. So we do have to show them that pain's not the problem. The compensation is the problem. Pain is simply the alarm. Okay, so the underlying root cause is the subluxation. Pain is the alarm. And we have to be, as we all know, doing tests that objectively measure subluxation. So whether that's measuring x-rays, of course, neurological scans, which is going to help us get to the next level of subluxation, but bilateral weight scales, checking posture, checking ranges of motion, but not just checking them, quantifying them. So we can logically show the patient that there's a limit and we have something to measure as they improve, as they go under care, to take them out of that pain mindset. So the longer the structural distortion remains, the more your body normalizes the dysfunction. So in other words, the patient is dying silently. And that's really important to understand. And that's really important to relay to that patient. So instead of telling them that their neck is out or they have a bone out of place, it's really important to relay the message that their spine has adapted into this stress pattern. They've adapted into a dysfunctional pattern, and that dysfunctional pattern is destroying their body. So our job as chiropractors is to help the body unwind that pattern before it becomes permanent, before it starts to cause death, accelerating disease and dysfunction. So that positions ourselves differently. Which takes us to the second level of subluxation, which is the neurological subluxation. So this is where we start to increase the conviction. And this is really important to relay through your reported findings, through your doctor's report, and have ways, again, to measure this logically and show people that the spine houses and protects the nervous system. So again, this goes back to your day one scripting. And here's the thing, this is what's really important to communicate, is that the nervous system, it's not just the fact that the nerve is choked or pinched. The nervous system controls all healing and all function. It controls the hormones, it controls sleep, it controls digestion, it controls immunity, It controls the person's level of energy, their emotional regulation, so how they react to their environment, how they react to the world. And here's what's really important. It controls the cellular reproduction and replacement of all organs. So one of the things that we really have to help the patient understand is that their body is constantly replacing themselves. And it's either replacing themselves, those organs are replacing themselves with healthy cells or with unhealthy cells. And if they choose to remain subluxated through their lifetime, their organs and their body are replacing themselves with unhealthy cells, and they live a lackluster life that's typically shortened. It's really important to help them understand that. Think about the cell tower. This is a fantastic analogy. So the cell tower, if your phone, if you're in an area where you have low cell coverage, your phone only has one bar, things don't work properly. You try to send a text message and you get a message that it didn't send. It's not the apps, it's not the phone that is the problem. The problem is the signal. It's the same with the body. The organs of the body are apps, and the nervous system is the medium that sends the signal. And subluxation distorts the signal. So if people understood that they're a walking cell phone, if you will, they need to have good signal to function well. But if they're subluxated, they're living in an area of low signal coverage that it just their body will not work properly. So symptoms result from dysfunction due to poor signal. So what we do, we remove the interference to improve the signal. So think about this is that chiropractic is not about bones. It's not about moving bones. It's about improving communication. That's what it is. So health, again, is not how you feel. Health is how well you function. Healing is how well the body replaces itself with healthy cells. Very, very important message to share with your patients. So you are healing all the time, 100% of the time, 24 hours a day, 365 days a year. You're always healing, whether you're symptomatic or not. If you feel good, you're still healing because your body is replacing itself all the time. Every single organ, every single cell in your body is replacing itself, and it's either replacing itself healthy or unhealthy. If you're subluxated, it's unhealthy. So the question isn't, does it hurt? The question is your body adapting the way it was designed to? And this is what really helps to separate you. When you start asking questions like that, Mrs. Jones, are you aware that your body is not adapting the way it's intended to? And you get the patient thinking differently. They focus away from their symptoms, away from their pain. And here's the third level of subluxation. And this is really important. And I want to make sure that we're able to discuss this where it doesn't sound religious, it doesn't sound weird, it doesn't sound somewhere way out there. And I think if you can get really good at sharing this, this is where you build warrior patients because they think differently. Everybody inherently knows what we're going to talk about. Everybody inherently knows that, but they just can't put it into some context. And so if you can put it into a context where it relates to keeping their subluxations clear so they can express their full God-given intelligence throughout their lifetime and reach their full potential, people get that. Every single person I've known in my 34 years of practice that's built a big practice is able to communicate this on a very articulate level. Okay? So this is where you really create emotional depth. So, and again, we frame this very carefully so it doesn't come across religious, it doesn't come across weird. It comes across with purpose, connection, and alignment. Okay? So in other words, you're not just a body. You're not just a human being. You're an intelligent being expressing life through the body, through this matter that you have. You're an intelligent source of spirit, if you will, that's expressing intelligence through this body. And when your nervous system's overloaded, here's what happens. Your clarity decreases. So therefore, your performance suffers. When your nervous system's overloaded, your patience decreases. So you're angry and frustrated. That increases. Your presence in the moment decreases when you're subluxated. Therefore, your relationships suffer. Your ability to create new relationships or your ability to create loving, caring relationships with your family, your spouse, your children, or business relationships, everything suffers because your presence decreases when you're subluxated. When you're subluxated, your energy decreases. Therefore, your production suffers. When you're subluxated, your purpose becomes foggy. Therefore, depression and anxiety result. You can see that this These 5 points here encompass 95% of the world, that the world is walking around subluxated. And this is what we call spiritual disconnection. People are not able to express their full God given intelligence within them through their body, through their being. Not because the spirit is damaged, because the expression is interfered with. And if you can get to the point and create a platform for yourself to share that with people, your practice explodes because people get that. They now all of a sudden you're different. You're not the quote unquote backcracker. You're not the pain reliever. You are someone who can help them express their full potential in their life. Think of the light bulb. Okay, you think of an incandescent light bulb. The light bulb is not the source of light. The light bulb is simply the expression of the power. And this is a really cool analogy. So the light bulb is simply the expression of the power. Your body is the expression of the power within it. A dimmer switch for that light bulb is the subluxation that creates resistance to that power. So if you turn the dimmer switch up, that subluxation gets worse. Obviously, the expression of that power becomes a lot less in that light bulb. We have to go in and we have to remove the interference, remove the dimmer switch, remove the resistance so that the power can be expressed fully and the light bulb shines bright. So if your body is the expression of the source, the intelligence within you is the source. You can call it innate intelligence, you can call it spirit, you can call it God, call it whatever you want to call it. But the source is where the power comes from, and the nervous system is the medium where that power shines through so that it can be fully expressed in your body. And it's the subluxation that creates resistance to that power. It's an incredible analogy. People get it. People understand it. And if you can say you are the person who, you're the electrician who can go in there and remove the resistance, remove the interference, and get their body shining bright to its full potential, people want that. So when your nervous system is clear without subluxation, life expresses itself more fully in the human being. And this lands incredibly deeply with people. So here's a question for new patients is that, we always talk about the hot button and finding the big why. Who are you when your body is functioning at its highest level? Who would you like to be if your body could function at its highest level? What would you like to accomplish? What would you like to do? What are your dreams if your body can function at its highest level? This changes people. This gets them thinking about their potential. And that opens them up to being receptive to having their interference removed, having their subluxations corrected, and engaging in lifetime chiropractic care. So,
one thing I just want to jump in there, Colin.
thank you.
A lot of what Colin just covered there is going to come down to your understanding of subluxation first and like what's inside the doctor when they walk in the room. And I really want you to sit on that for a second, take some notes from that, write some things down to follow up on later today. If you have questions, please jump them out here. But your understanding of it, and you don't have to say everything that Colin just went through in the first 20 minutes, but where are you at in your understanding or how serious you take subluxation is going to determine how that interaction goes in the room versus a patient says something, you talk about a back pain and you move on to the next question, or they say something, you dive into how it's really affecting them at a core level, a life level, how long it's really been there for, how it's affecting them because you understand there's so many more pieces to this. Or you start connecting. I also notice in addition to your back pain, you are dealing with digestive problems. Can you tell me about that? Because you know they're connected, right? So I really want you to sit on that for a second because that is huge versus the doctor walks into the room and can really offer a patient who's looking for solutions a true outcome difference versus what they get to see just, the pop and pray chiropractor down the street or walking to see the medical doctor or the physio, etc.
So hopefully you can understand as we talk about this, for those of you who are still in the symptom model, where you're still addressing how are their headaches, how is their back pain, how is their symptom coming along, and keeping that patient stuck in the symptomatic, like when the symptom's gone, then I'm better and I don't need care anymore. If we can start to shift them into that, and again, the lowest level of subluxation is about correcting their spine, getting their curve back, and all that. But if you haven't connected the rest of it, they're still a short-term patient. They might stay a little longer than just symptomatic relief, but they're not a lifetime patient yet. So the correction isn't about getting back to normal. It's about becoming more fully you And that's how you help people understand that this is a lifetime bridge to care. So the mindset shift here, again, the pain care model, if we're still in that pain care model, people come in with pain, they get relief, they stop care. And I mean, you have patients like that. We all have patients like that. And there's the signals of why they're still in that mindset. How many visits do I have left in my care plan? And you're going to have a lot of people there, people that are choosing to pay as they go. They're the ones that are stuck in that model. But the correction model is what we have to understand, and what we have to communicate is that structural correction takes time. I mean, we've all known people that have braces on their teeth. Some of our kids have had braces on their teeth. I have four of them. I've had, four kids with braces. And for those of you who've had it, it's not a quick fix. You don't have braces on for a matter of weeks. You have it on for a matter of months or years. So structural correction takes time. Braces straighten teeth in 18 to 24 months typically. Neural rewiring takes repetition. Nerve regeneration takes years. When I had my neck injury and I broke 4 bones in my neck, I had complete radiation, numbness and tingling down to my fingers for 18 months before it went away. All the bones had healed, everything had healed. I was getting adjusted again, but it took 18 months for those symptoms to start to go away, for those nerves to regenerate because of the damage that happened. So neural rewiring takes repetition. So for those of you who are recommending, 10 visits, 12 visits, and short-term care, you're not giving the patient an opportunity to heal. So we have to, and we're going to talk about care plans coming up here. We have to get them to the point of thinking long-term. So lifestyle adaptation takes consistency by building and maintaining habits. Chiropractic care is a habit. It needs to be relayed like that. It needs to be explained that this is a lifetime habit. So relief is the beginning. This is a great phrase. Relief is the beginning. Correction is the process, but optimization is the goal. And maintaining that optimization is the goal. And that really could become a signature line for you. So how to position this in the consultation. So instead of asking people what brings you in, here's a great question, and I would suggest write this down. What changes in your health or life would matter most to you if your body functioned better? That'd be a great question on day one. What changes in your health or life would matter most to you if your body could function better? If we could get to the root cause of what's ailing you right now, if we get to the root cause of the dysfunction, the dis-ease that's happening in your body, and correct that, get your body expressing itself fully, what changes in your health or life would matter most to you? And that takes them out of that pain thinking. So here's 3 care plan models. And I'm bringing this up, and I purposely put these in here because of some of the coaching calls I've had lately where people are really struggling with how to present care plans, how to get people off of the pay-as-you-go, how to make it profitable, but also something that people can adapt to and say, yes, I can do that, and are willing to give you their credit card, prepay, or at least go on a monthly care plan, payment plan. So these are designed for compliance, correction, profitability, and also home accountability. So in other words, keeping them accountable outside of the office. So it becomes a lifestyle change. So option 1, this is a foundational correction program. This is like a low-level correction program. And I'm going to pre-frame here and say, this is not my first choice for the care plan I would recommend for people. This is the backfall choice, but this is a foundational correction type of program. So this is good for new patients, obviously, that are starting. It's a 12-week care plan. For those of you who are suggesting anything less than 12 weeks, it's not even touching, you're not even scratching the surface for correction. You have to at least give them a chance. If they're subluxated, if you see x-ray findings that need correction, if you see neurological findings that need correction, ranges of motion, whatever, you need at least 12 weeks. You go into any exercise program, P90X, Insanity, 75 Hard, they're all based on a 12-week turnaround. Like everything's based on that. That's, when you introduce that stress into your body, it takes time for your body to adapt and change. So a 12-week program is minimum. So the frequency would be 3 times a week for the first 4 weeks. You have to have 3 times a week in the early stages to get the body to change because it's in the stress pattern. It needs to be adjusted regularly, and you need to put the stress into the body regularly for it to adapt early in the first 4 weeks. The first re-exam has to happen at 4 weeks or 30 days, whichever comes first. And then if they're improving somewhat, any bit, then we can advance them to 2 times a week for the next 8 weeks. That would be a minimum care plan in my estimation. 28 visits. It includes obviously spinal adjustments. You have your in-office therapies, your traction, your postural rehab, wobble disc, sleep rolls, that type of thing, mobility drills. They would get their home care kit, which includes the sleep rolls, the wall traction, wobble disc, maybe a Cerviguard. And typically that's priced between, say, 2,500 or 2,497 to $3,000, 2,997. And that would be, I would say, a minimum standard of care plan recommendation. It's profitable, it gets people committed to a corrective type of care, and then hopefully we can get them through proper engagement into some sort of a wellness or maintenance care. And I like to say subluxation prevention care program after that. So this is number two. This is option number two. And this would be option two would be my first choice as far as what to suggest for people, right? So person comes in, and then that way you can always fall back to the first care plan because the first care plan is less intense than this option two. So this is a more advanced neurostructural reset type of care plan. And this is for somebody who is in typically in phase two. So if you're doing x-rays and you see degeneration, like not just misalignment, but you see degeneration, you definitely see some nervous system involvement. They have problems with their scans, ranges of motion, postural changes, whatever testing you're doing, you see something that's advanced. This is a 6-month, minimum 6-month care plan. We used to do 12-month care plans, but I would say this would be a minimum care plan for somebody who's in a phase two having degenerative changes. You start with 3 times a week, typically for the first 8 weeks. Re-exams at 30 days, re-exams at 60 days. Okay, so, and then typically by 8 weeks, then you could advance them to 2 times a week. You do that for another 8 weeks, and then same thing, re-exam at 90 visits, or 90 days, re-exam at 120 days, and then once a week for the next 8 weeks. So it's a 48 visit care plan. Obviously, it includes adjustments. This is something now you can add whether you do decompression or a modality, if you choose to do that. It's totally optional, but this is a comprehensive type of care plan. So you're addressing inflammation, you're addressing some of the things that are causing their symptoms as well. But again, you're getting to root cause. You get them doing the rehab in your office, wall traction, rehab, head weights, vibe plate, Cerviguard, all that stuff. You do your progress imaging, so re-x-rays, re-scans, that type of thing, to make sure you can explain to them how objectively they're improving. And also, they would get a comprehensive home care program. So sleep rolls, wall traction, wobble disc, a Cerviguard, whatever. And typically, this pricing would be anywhere between $4,800 and $6,500 for 6 months. So they're paying $1,000 a month, somewhere in there. That's where I would start. That's where I would start. And then if there's resistance for whatever, I can't afford the time, I can't afford the pricing, blah blah blah, I start negotiating. I don't like to negotiate my recommendations. I feel that just diminishes my integrity. If they have a problem, they need correction, I recommend something that they need. I'm not going to start to, oh, I can come 2 times a week. Okay, we'll do that. Okay, it's just going to take long. No, I don't like to do that. So what I would do is I would go back to the first care plan and say you still need to come in 3 times a week. So if you suggest 3 times a week, I would go back to a care plan that say you still need to come in 3 times a week. I can play with the price only when it's necessary. And I was very choosy on who I would negotiate the price with, but I would not negotiate the intensity of the care. So care plan 2 is, sorry, I was just going to say,
Oh yeah.
once I was just going to say, Sarah, this is really for people who are committed, and you only get to this point when you've done the day 1 and day 2 properly and explain the seriousness of subluxation and how it relates to them. So sorry, yeah, go ahead, Sarah.
Do you mind just scrolling up quickly to the frequency one more time of the second option? Okay, thank you.
3 for 8, 2 for 8, 1 for 8. 48 visits. All right. And then obviously the third care plan is the lifetime performance membership. So we like to call this the maintenance plan. I would suggest have a related handle for this plan. Have a plan that increases the value for the plan. It's not just a maintenance plan. It's a lifetime performance membership. Many people could do a maintenance program for their car and they choose not to. I mean, they let the oil life run over. They don't go in, change the tires when they're supposed to change the tires. So people ignore things when it comes to maintenance and tend to wait till the problem starts to show up. So by having a proper handle that repositions their thinking that this is about lifetime performance, it's a much better way to position it. So this is great for wellness retention. It happens after correction. So typically it's a frequency of 2 to 4 visits per month. So it's either weekly or it's biweekly. I don't suggest monthly care. I mean, some patients choose to do that. That's not my recommendation. Will I still adjust them once a month? Yes, I will. But the point is, my recommendation to those people is either weekly or biweekly. Again, I've talked about that study by Tapio Vitamin that says subluxations occur, and when subluxations occur, degeneration happens within 6 to 12 days. That's Clinical Biomechanics Journal in 1987, and I share that with people all the time. That why would you wait? Why would you wait till your spine degenerates until you come in and get adjusted? Stay ahead of it. So it includes adjustments, quarterly scans or re-exams, monthly workshops, and typically we would x-ray people biannually that were on. If they were coming in weekly or bi-weekly, we would adjust them biannually, so every 6 months. And in many cases, depending on the person, I might just do one view. I might do a lateral cervical view, or I might do two views, a lateral cervical and an AP pelvis if they had any type of scoliosis. I wouldn't be x-raying the entire spine. If they were concerned about radiation, I mean, I could easily help them understand that one view, and I mentioned this to Sarah on our call yesterday, is that one view is less radiation than sitting in front of your computer for an entire day. So you can justify it that way by taking regular x-rays. If you just do a lateral cervical view to compare, then at least you help the patient understand why they need to continue with care. And again, they should be doing their home care, head weights. And typically what we did for people who were under maintenance care or lifetime performance care was they would get a cervical pillow, because doing the sleep rolls when you've been coming in for chiropractic care for 3, 4, or 5 years typically gets old. And we found that people really drop off. At the beginning, people that are engaged, they'll do their home care stuff. But as they've been there for a long time, they come in regularly, they're asymptomatic, they're not doing home care. They just don't put that in. So we got them doing cervical pillows. They sleep every night. People still sleep every night. So they slept on a cervical pillow, which helped maintain their curve. And that's the way we described it. And that was another income point for us. So, and some people that needed the head weights, they would do head weights on some sort of a regular basis. And again, monthly, maybe they're paying $250 to $500 a month. So this is where we protect and build the gains that we've created through the corrective care, right? And we maintain people for the lifetime. If they understand subluxation the way we understand subluxation, and we can help them get from that structural to the neurological to the spiritual component where they're improving their performance, removing interference, and really getting connected spiritually and physically in their body, they get it. And that's where they say, this is just a lifestyle. This is my, I go to work, I go to church, I go to the chiropractor, I go to the gym. These are just lifestyle things that are non-negotiables. And you become part of that when they understand it, if you've communicated it properly. So here's the thing, and we used to say this to people, you only get one spine, you have one nervous system, you have one chance for life expression. So the question isn't whether stress will affect you. It's going to affect you. It affects all of us. The question is whether you will correct it before it costs you the life you could have lived. Will you allow yourself or allow your body the opportunity to adapt and allow yourself the opportunity for that life expression to be fully expressed? Pain relief changes moments, right? You can build a practice where you make a mild, moderate living, modest living with pain relief care. You can do that. But when you start to be able to communicate subluxation on these 3 levels and help patients understand the performance and the connection of the spirit and the body, that's when your practice explodes. And that is really the key to $1 million practice if you want to practice corrective care. So subluxation correction changes lives. It really helps change the identity of your practice from a pain clinic into a performance and transformation center. Okay, any questions?
I have a question.
Yeah.
So 90% of the time when I break up a treatment plan for a patient, like they're very excited. They love the plan, they love the vision, everything. But then sometimes they're like, okay, so like when does it end? What is there something like typical that you usually say to that to kind of frame it so it's not like sounding like you're stuck with me for life, but also you kind of are, and that's like a like why it's a lifestyle and not like a treatment plan with an end date?
Yeah, so great question. And this is coaching call question stuff, because right off the bat, with you framing it as a treatment plan, Okay. And I'm going to say, so this is very important. Your words are incredibly important. And this is for everybody, right? For those of you who are still using the term treatment, what is a treatment? A treatment is an application to correct a symptom, right? So if you're using a treatment plan, they see that as an application or a time frame to correct a symptom. And therefore think when that symptom is done, my treatment plan is done. So we have to start reframing our communication to help patients to understand that this is not, we're not applying treatment, we are applying the removal of interference for full life expression. When should that end? Well, when should that end? It should never end. I mean, never. So that's a lifetime thing. It's a total choice, however long people want to benefit from chiropractic care. But my goal is I want them to understand it. I want them to understand that we are not in the business of treating pain or symptoms. So they can come in for as long as they want to. Maybe some people only want to come in until they get their symptoms corrected. Well, that's perfectly fine because I know they're going to be back, right? It's just a matter of time. So I hope that makes sense. But that's something that when we start coaching, that'll again make more sense, and we'll talk about ways to communicate that.
Okay. Okay. Thanks.
All right.
Hey, Dr. Colin.
Yeah. Hi, Phil.
Hey, yeah, just to piggyback on what you're saying there. I mean, there's going to be people that won't do the kind of care that you can explain it the best you can, and they still won't do it. But if you allow them to fail and allow them to feel comfortable returning, and then I know Dr. Colin, you explained this very well because you've explained it before, that if you make them feel comfortable on their return, they're going to come back to you. And then you don't say, "Oh, I told you so," but you just explain that typically this problem is relentless. It's a degenerative, relentless condition, and we always see it come back. And if it comes back for you like it does for most people, we want to get you under the correction that you deserve, when they come back. And then they feel comfortable, and then they'll change their mind usually after 2 or 3 episodes of, what they came in for originally.
Thanks, Phil. Excellent points. And so ideally, and here's the thing, and I want to try to summarize what Phil just said, is that we're in the business of loving people. I want people to come in and feel the love in our team. And I really feel we created an environment and a culture where they did feel love every time they came into the office, as soon as they stepped in the door. And we had that all the time. We're saying, people, there's an energy in here. It just feels different. So, but I want to make sure that we have systems in place that it's absolutely vital for me that everybody receive the message properly. And that's why we trained consistently on the way and the words that we communicated with people. And so we tried to accurately predict how many or what percentage of people would really understand and buy into what we were talking about. And it was never 100%, but that small percentage that didn't or didn't agree with it, I mean, we'd be happy to refer them to another chiropractor, or we'd be happy to let them know that the door's always open should they change their mind. But our goal was to make sure we did everything possible to increase that percentage of people who understood it, got it, and accepted it and wanted it as much as possible.
Question. For the option 2 treatment plan, is that only if they have phase 2 degeneration and worse?
Well, so great question. So is there a gold standard of when somebody would be considered a phase 2 or a phase 1? I look at everything. I look at what their goals are. I look at the chronicity of the problem. I look at past chiropractic care. I look at the structure of their spine. I look at their neurological scans. And I would say that if I felt that their life and existence was in danger of where they're going, absolutely they need an intensive corrective care plan.
Mm-hmm.
And I mean, if for whatever reason that didn't fit for them, or we couldn't work that out, then we'd fall back onto something less, but the intensity would still start off as the same.
Mm-hmm. Okay.
Okay. Yeah. Great question. So for those of you who do x-rays, and I would say a good way to kind of analyze that is we classify people into phase 1, where there's misalignment, if you will, but no degenerative change. Whereas phase 2, there's misalignment and degenerative change, disc thinning, osteophytes, whatever. And then phase 3 is severe, where you get fusion and stenosis and all these other problems that are going to really affect somebody drastically. But anybody that's even entering into a phase 2 needs intensive care. Great questions. Thank you guys for participating. That's very, very helpful.